new details on the plans to slash 10,000 full-time jobs within the Department of Health and Human Services. RFK Jr. and the Trump administration say the move is to streamline functions and cut costs from the nearly $2 trillion department. NewsNation's Joe Khalil is following this from D.C. So, Joe, a lot of people wondering if this will ultimately impact Medicare and Medicaid.
Yeah, those are the big questions. Are these cuts going to impact services in any way, with a particular eye on Medicare and Medicaid? And I can tell you a lot of reaction already here on Capitol Hill. This is essentially the Health and Human Services Department's version of DOGE cuts. In fact, Secretary Robert F. Kennedy Jr. said as much, that this is their iteration of it. He put out a video today explaining some of the cuts and the reasoning for it. And in his view, he says the United States over the last 30 or 40 years has spent the most per capita on health care of any industrialized country in the world. Yet, he says, we are not seeing the results of that. And the reason is he believes that there's simply too much bureaucracy, too many agencies that do too few things properly. He says it's time to consolidate them. So this is not only workers being laid off, but this is also a serious consolidation of the smaller agencies within HHS coming together. And you take a look here, the workforce is now going from 82,000 to 62,000. You may be asking, that's 20,000 less, 10,000 layoffs, but he says 10,000 who have voluntarily stepped down from their positions. You've got 10 regional offices around the country that are going to be cut down to 5, and then obviously more cuts beyond that. And when you dig into the numbers here, the FDA is going to lose 3,500 workers. The CDC is going to lose 2,400. NIH will lose 1,200. CMS, Centers for Medicare and Medicaid Services, they will be losing 300 full-time employees. So these are significant cuts here. Take a listen to what some senators said. You're going to hear from Senator Hickenlooper, a Democrat, Senator Marshall, a Republican. Very different opinions on what this is going to mean overall.
We're talking about Medicaid. We're talking about, all kinds, all the research we do to create the miracle vaccines, all this stuff. You can't just willy-nilly make these, thousands and thousands of people. It doesn't make sense.
I think the people that are touching patients, that are touching the important research, that are touching the approval of medical devices, I think that those people are intact. And at the end of the day, it'll be a more efficient system being ran by people that care about their job.
And Nichole, we've been told that Secretary Kennedy did brief at least Republican senators on the Senate Health Committee before making this announcement today. Senate Democrats, on the other hand, told us they did not get any kind of warning that this was coming. So these cuts today took them certainly by surprise.
All right. Joe Khalil live for us there in D.C. Thank you. Well, thanks for watching. Go to joinnn.com to find News Nation on your screen. And don't forget to click the red subscribe button below to get more of News Nation's fact-driven, unbiased coverage.